like to call the meeting of the Joint Internal Services and Health and Human Services Committees to order, and the first order of business is to pledge allegiance. Please rise.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I need a motion to adopt the agenda.
Romano adopts the agenda.
Support Zinner.
Thank you. Commissioners Romano and Zinner made the motion and seconded to adopt the agenda. Any discussion? Hearing none, please vote.
Motion passes 11-0.
Thank you. Item 4, I'd like 4A and B together. It's the Internal Services Committee minutes from December 2nd and the Health and Human Services Committee minutes from December 3rd. Motion to approve?
Motion to approve.
Support.
Thank you. I believe I heard Commissioner Groh and Lucido make the motion and seconded it for 4A and B. Any discussion? Hearing none, please vote.
Motion passes 11-0.
Thank you. Next is the first opportunity for public participation for those who wish to speak on any agenda item for a maximum of 3 minutes. There'll be a second opportunity for public participation for any subject later in the meeting. Public participation agenda items. Agenda items, public participation. Seeing no one, hearing nothing, we'll close public participation and move on into Internal Services Department recommendations. The first item, I'd like to take 6A and B together. It's Capital Improvement Fund, People-Driven Technology, Zscaler licensing for $383,974.60. I need a motion to move the full board.
Support Zinner.
Thank you. Commissioners Lucido and Zinner made the motion and seconded it to move 6A and B to full board. Jaco, you're up.
Good afternoon, Commissioners. Happy New Year to everyone. The first item here, a few years ago, Macomb County IT initiated a strategic shift towards zero trust security and building this roadmap. A proof of value was conducted in 2024 with a company called Zscaler, a software client, to increase our transition to securing our infrastructure. The strategic initiative aims to enhance Macomb County's resilience against evolving cyber threats, ultimately safeguarding our critical business operations and protecting our valuable assets. It is a security model that assumes no user or device should be inherently trusted, regardless of their location within or outside the organization's network or who they are. This approach emphasizes continuous verification and least privileged access, requiring all users and devices to be authenticated and authorized before accessing any resources, even if they're already within the network. Zscaler was installed on computers to inspect access to all network locations, regardless of geographical location of the computer. Macomb County IT has determined that this proof of value has been successful, and we would like to continue with the full implementation of this. The total cost is $383,964. We budgeted, and that's a one-year subscription. We budgeted $523,000, but was able to drive down the cost due to the architecture that we are using.
Thank you. Commissioner Kraft?
Thank you, Mr. Chair. Jacob, how are you? Thank you for mentioning that too, because that was going to be my question, because it's here in the anticipated capital plan that was the estimate. So I just wanted to thank you for working to drive that cost down. Thank you, Mr. Chair.
Thank you. Seeing no other speakers, please vote.
Motion passes 11-0.
Thank you. Moving on to item 6C, budget amendment for capital improvement plan, Isilon and Power Protect Cloud, Dell financing payment 5 of 5, getting to the end there. $258,748.69. I need a motion to move this to full board.
Support.
Thank you. Was that Commissioner Hall? And Commissioner Lucido made the motion and seconded it to move 6C to full board. Jaco, you're on.
Commissioners, this is the fifth and last payment for the Isilon, which is our file serving environment, and Power Protect, our backup environment. This payment is for $258,748 and was done over the last 5 years at 0% interest.
Thank you. Seeing no speakers, please vote.
Motion passes 11-0.
Thank you. Moving on to 6D, agreement with information technology for maintenance
GPS
agreement.
signal lost.
Maintenance agreement for first quarter 2025, total cost of $125,350. And this is for RP Pro for $76,000 and Security Scorecard for $49,350.
Motion to recommend to full board.
Thank you.
Support.
Thank you. Commissioner Grote and Kraft made the motion and supported it to move 6D to full board. Jaco?
Commissioners, this is for two maintenance items. The first one is abnormal security, which we use for our inbound email security and has been working really well for us. And the other one is security scorecard, which monitors third-party risks for us as we implement SaaS solutions and things like that. It helps us to monitor that risk and make sure that we take good care of that. It is for a total of $125,350.
Thank you. Commissioner Hall?
Thank you, Chair. Hi, Jaco.
Hi, Commissioner.
What's an example of abnormal security inbound email?
Megan, maybe I'll ask you if you could talk a little bit about abnormal and exactly what it does.
Abnormal monitors for any malicious email.
You have to come up here.
Megan is our security administrator.
Hello.
Before you get started, would you define whether abnormal is a condition or a company?
It's a company. It's a system. It's a company.
Okay.
So abnormal monitors for inbound emails that may or may not carry malicious intent or attachments. It would prevent it immediately quarantining the threat, so it would not hit your inbox.
Thank you.
You're welcome.
Thank you.
You're welcome.
That's all I have, Chair.
Thank you. Seeing no other speakers, please vote.
Motion passes 11-0.
Thank you. I am now pleased to turn the gavel over to Commissioner Lucido, the Chair of the Health and Human Services Committee.
Thank you, Commissioner Van Sickle. I would like to open up the Health and Human Service Committee meeting, starting with number 8, Health and Human Service Committee Department Recommendations. We will move to item A for Motor City Electric Technologies, key scan, access, control door readers, and related equipment. And I believe we have Director Andrew here. How are you today?
Hello, Commissioner, and
Good.
Hello to all the commissioners and welcome to our new commissioners and also our new board chair. Congratulations. So hopefully you all had a great year. Good to see all of you. In front of you, the first item that I have for you is a motion to approve the purchase of the Motor City Electric Technologies contract for additional badge scanners for our Southwest Health Center. This is our health center located in Warren. This was in the area that was vacated by Health and Human Services. If you've never been down to that location, previously the health department occupied half of the building and the state occupied the other half.
Andrew, if I can just, 1 second, I'm sorry, I messed up.
Make a
Can I get
motion.
Motion to recommend a full board.
Support.
Motion by Romano, supported by Van Sickle.
I should know by now to remind
should
you.
too.
So, these are key scans that will go in that vacated part that the state health department vacated, and we're administering WIC services out of that location. So these are site improvements. The good thing about these is they can be repurposed if we need to ever vacate that location, which we don't have immediate plans to do. We do have some future things that we need to consider for that location in the future, in terms of the future of that exact location. But the good thing is that this can be repurposed, so we can take the technology with us and use it in a new building. So this is going to be funded out of our emergency preparedness grant dollars. So these are grant dollars that are going to be used for this project. I'd be happy to answer any questions. Thank you.
Thank you. Commissioner Van Sickle.
Thank you. Good afternoon, Andrew.
Good afternoon, Commissioner.
I appreciate this is coming out of your budget, but this seems more like a facilities thing to install equipment.
So we've done it both. I think in typically larger projects where there's funding available for these types of initiatives, we can use capital dollars. If the project can be related to, in this case, security, which could be related to our emergency preparedness program. So that site is our secondary emergency communication center that we'd use for backup for the health department. So it would fall underneath that grant program. And we really try to be smart about our grant dollars and use them in ways that could save us county general fund dollars.
So did somebody in your organization then go out and bid this out?
So this
Or did
specifically,
facilities bid this out?
so I don't believe facilities or IT has ever bid this out, but this is, Motor City Electric has been a long-standing partner, contractor of these key scans. And so this would be consistent with the technology and the work that we've used in the past for other locations around the county, not just health locations, but all county locations for this specific key scan project.
That was my next question. I certainly recognize Motor City Electric as being a longstanding vendor, and I was going to ask if the particular items installed were going to be totally compatible with all the others across the county.
They are, and we did double check and verify, and we have verified with IT to make sure that they are compatible with countywide systems.
Okay, so will these actually report back across the network to some central location?
That's a really good question, Commissioner. I don't know the answer to that. I believe how it works is that it's captured in a program, and I know IT and others in the county have access to that program for logs and security access. So it's not just something that we control on the health side, it's countywide.
Okay. Thank you. Thank you, Chair.
All right, seeing no other speakers, can we please vote?
Motion passes 11-0.
Now we're going to move on to items B and C, a budget amendment for the Health Department Grant Fund, fiscal year 25, MDHHS Comprehensive Planning, Budgeting, and Contracting in the amount of $411,992, and a budget amendment to the Health Department Kindergarten Oral Health Assessment Program in the amount of $501,834. Can I get a motion to recommend a full board?
So move.
Support.
Commissioner Ha and Van Sickle. Thank you.
Thank you, Commissioner. These two items are somewhat tied together in response to a new program. This is the third year of the state passing into law the kindergarten oral health assessment program. And we specifically waited till year 3 to really look at implementation because there were some problems with this program, as many new programs are statewide when they roll out. Some of those kinks have been worked out. It still is far from being a perfect program in terms of the state requiring this program. But what this program would do is it's a law already in place that requires first-time students, so it could be kindergarten or first grade, that they have a oral health assessment done. Does not necessarily mean that there's actually oral care provided, but at least a visual assessment for children as they enter into the kindergarten, first grade programs to get that assessment. And really the goal of the program is to hopefully capture and catch preventative oral health measures that will not be more serious down the road. So this program will really look at and assess visually, and with that, make referrals to dental programs in the county that do have services and programs at no cost to the families. So what this program would be established through the health department, contractually hiring on our dental hygienists and other support staff to work with a lot of the schools, because this requirement falls heavily on the schools to make sure that the children have these oral health assessments. It's very similar to vision and hearing screenings that you go into, and you're required to get that for your child to be enrolled in school. This is a similar requirement. However, the big difference there is that this could not preclude students from attending school if they do not get this assessment done, whereas the others would. So you could not attend if you do not provide that paperwork. There's no sign that that will change in the near future. We know how important it is to keep children in school, especially based off the recent history with COVID. So it's important for us to keep kids, but it's also important that we look at oral health because of all the ties to physical health down the road. So the longer that we wait to do oral health care, the more serious problems, and typically the more expensive it is. So we want to make sure that we try to provide that assessment early on in child's life, and hopefully they continue it on. So this program would help administer this oral health assessment. This is being done in part by a grant from the state. One of the big downfalls of the state is that they don't adequately fund this program. As you see, it's only $169,000. We anticipate this program needing just over $500,000 to administer the program between the support staff. We're able to do this program because we're able to take and move some money that was in hearing vision without hearing and vision suffering any loss. We got additional money through such a local public health dollar increase that I've taken before you several months ago last year. But we're utilizing money from hearing and vision program savings and moving those dollars to the kindergarten oral health assessment. I know that might be confusing, so there might be some questions, and I'd be happy to answer questions.
Thank you. Commissioner Zinner.
Thank you, Chair. What you've answered, your explanation, I think, was very well done. It explained a lot of things. My question to you is, what are they looking for? Are they looking for infections, teeth problems? Are there more medical situations that they're looking for in the teeth or the mouth?
It would just be a visual inspection of the mouth. So they're looking at teeth, gum lines, signs of gingivitis. This would be done by a dental hygienist. It has to be a licensed professional that does this. So they're looking at tooth decay and early signs of that so that hopefully we can provide care.
I have to say that even in very educated homes, sometimes I have seen where children brushing teeth is nothing like it was when I was a child. It's just, everybody's busy, and I don't know how many houses are like that, maybe one or two that I've seen, but it's, they're treated well, they've got great food and everything like that, but I'd never hear at bedtime, brush your teeth, which is, of course, very different from years ago. Thank you, Chair. Thank you, Andrew, and thank you, Chair.
Commissioner Kraft.
Thank you, Madam Chair. Andrew, question about the hygienists. So are those folks selected by the state? Do we select them? If we select them, what's that process look like?
So we would select them. We would work with a contractual company to bring those on, just because the county does not have a dental hygienist already classification.
Right.
And because it's a grant program, hopefully this program will be sustained and go on to the future. But we feel, because it is a new program, to start with contractual staff in case the program does go away and the grant dollars do go away, to make that change. But this would be somebody that we hire and is on staff from Macomb County. We felt very strongly we did not necessarily want to do the program the best, contract all of it out to a third party. So it is contracted, but the staff will actually be in-house at the health department that we are working with, that we can work with the schools. A lot of the work's going to be done at kindergarten roundup and events like back-to-school events where we can provide the services.
Got it. Thank you. Thank you, Madam Chair.
I do have, okay, Commissioner Sabatini?
Hi, Andrew. So we're not going to contract this out, just to be clear. We're going to in-house this staff and make it part of a program that already is existing.
So it's not an existing program. It's a totally brand-new program that doesn't.
I'm just saying the event that you're going to kind of contribute it to. Is what I'm
Correct. So it's going to be a health department where we're going out. The hygienist is going to be a contracted employee, but is going to be housed within the health department.
Okay. Just curious with that decision that was made. I know there are companies that like specialize in these types of services. What was the reason to not contract out rather than to in-house it?
That's a really good question. We put a lot of time into this. We looked at different models around the state for others that have done this program. The problem with contracting it with a company, so let's say a mobile dentist operation, and those do exist. There's not a ton out there, 2 or 3. Problem with that is that what we're finding and hearing from parents is that they're running issues. The same company cannot bill. So if they bill, for most of these companies to make it worthwhile, they need to bill insurance. To do that for the assessment, you cannot legally do that for the assessment and provide care. So if you're out there and you assess and you find that this child needs work and needs cavities filled, they can't bill for the assessment and the oral care. So then that's on the parent to pay that difference. And so some parents and families were getting very frustrated with having bills that they would have to pay because the insurance would not cover both of those if it's done by the same party in the same group. By us doing that assessment, it does not put that burden on the parent. They could still get the care and go at a dentist's office and get that cavity filled or whatever the service might be, and they can bill the insurance, and that's okay.
Got it.
It's more of a Medicaid issue.
Yep, exactly. Okay, thank you. Thank you, Madam Chair.
You're welcome. Commissioner Van Sickle?
Thank you. Again, is your department doing anything to promote oral health education in conjunction with this inspection?
So that will be a part of the assessment, is educational materials for families and schools to have, not just the assessment part, but build that up. And that would be what's also part of the team, and the dental hygienist and the support staff would be also working on that with the schools. So it'd be a complete rollout, and I'm glad you asked that question, because it is, just not part of the assessment, but it's also the education that Commissioner Zenner mentioned, as well as, about flossing and brushing our teeth and reminding families of how important that is.
And did I understand you right that, well, this is a new program, but possibly in the future, a few years out, you might want to actually bring staff on board?
As a dental clinic? Or is that, sorry, Commissioner, is that
Maybe
the
I didn't
question?
understand what you were saying.
So I was talking
I
about,
understand now the employees are going to be contracted employees, not, we're not contracting out the whole process. We're doing the process, but we're hiring temporary people.
correct, contractual employees that have advantage of it if we need to pivot and make, decisions down the road if all grant dollars go away for this program.
Okay, because I was wondering if we ever did go to permanent employees, what the school year doesn't go all year, So it would seem that with the contracted employees to make the most sense.
Correct.
Okay,
That's why we made that decision.
thank you. Thank you, Chair.
Welcome. I guess my question was for you, is there a certain timeline that the assessments have to be done from the time school starts?
So, really great question. It's a calendar year, so it's based off assessments in that school year.
Okay.
So all the children are required to provide that assessment or proof of that assessment within
sometime
that
throughout
school year.
All right, that's all I have. I see no more questions, so can we please vote?
Motion passes 11-0.
All right.
Thank you, Commissioners.
Thank you very much.
Appreciate it.
All right, we'll move on to item number 9, public participation. This opportunity is for the public participation for all of those who wish to speak on any issue for a maximum of 3 minutes. Seeing none, we'll close public participation, move on to item 10, which is commissioner comments. Looks like everyone's jumping in to speak here, but we will close commissioner comments and move.
What was that over there?
Have motion and support for adjournment, please vote.
Great meeting, Sarah.
Motion passes 11-0.